Good morning, everyone. I'm excited to welcome you to today's presentation. We're going to focus on the updated questions for the Qatar Prometric Nursing Foundation exam. This session is specifically part 2 of the series. Throughout this presentation, we'll review Prometric-style questions, complete with options and answers to help you prepare effectively. So let's get started and dive into the key topics that will enhance your understanding and confidence. All right, let's talk about the first step of the nursing process, which is assessment. This is a crucial starting point because it involves gathering all the necessary information about the patient. During assessment, we observe, listen, and ask questions to understand the patient's physical, emotional, and psychological status. Think of it as laying the foundation for everything that follows. Without thorough assessment, we might miss important clues that could impact the care plan. So this step sets the stage for accurate diagnosis and effective intervention. Remember, assessment is about being attentive and comprehensive. It's the key to providing safe and personalized care. When it comes to maintaining a sterile environment, washing hands is one of the most fundamental and effective steps we can take. It's a simple action, but it plays a crucial role in preventing the spread of infections. While sterilizing instruments, wearing sterile gloves, and using autoclaves are all important, they are more about sterilization, completely eliminating all microorganisms. In contrast, washing hands is a key component of medical asepsis, which aims to reduce the number of pathogens to prevent infection. So, when asked which is an example of medical asepsis, washing hands is the correct answer. Remember, these practices work together to keep both patients and healthcare workers safe, but hand hygiene is often the first line of defense we have. Now let's look at some common patient positions. We have supine, where the patient lies flat on their back, prone, where they lie face down, Fowler's position, which involves elevating the head of the bed to a semi-upright position, and lithotomy, where the patient lies on their back with hips and knees flexed. The correct answer here is Fowler's position. When it comes to managing dyspnea or difficulty breathing, Fowler's position is typically the best. Elevating the head and torso helps reduce the work of breathing, improves lung expansion, and can make it easier for patients to breathe comfortably. This position is especially useful in acute respiratory distress or when a patient is experiencing significant shortness of breath. It connects to our overall goal of ensuring patient comfort and optimizing respiratory function in various clinical scenarios. Now, when it comes to patient safety, 2 identifiers are absolutely essential. These are the key pieces of information we use to make sure we're matching the right person to the right treatment or procedure. The most common identifiers are the patient's name and date of birth. These help us verify that we're providing care to the correct individual. It's important to remember that relying on just one identifier isn't enough. Using 2 identifiers adds an extra layer of security and accuracy, reducing the risk of errors. This practice isn't just a recommendation, it's a vital part of maintaining safety in any healthcare setting. By consistently verifying these identifiers, we uphold the integrity of the care process and protect our patients from potential harm. This focus on safety ties into the overall theme of providing quality, reliable care at all times. When it comes to documentation, the main purpose is actually quite broad. It's not just about keeping records, it's about educating the family, making sure they understand the care being provided. It also protects us as nurses legally, offering a clear record of what happened and what was communicated. And of course, good documentation improves our communication with the entire healthcare team. So, all of these aspects are interconnected and essential. That's why the correct answer here is all of the above, because effective documentation serves multiple vital functions in our practice. Let's take a look at the normal adult respiratory rate. The typical range is between 12 and 20 breaths per minute. This rate is important because it helps us determine if someone's breathing is within a healthy range. If the rate is too low or too high, it can indicate underlying issues that might need further investigation. Remember, a normal respiratory rate is a key component of assessing overall vital signs and understanding a person's respiratory health. So, when you're evaluating a patient, keep in mind that 12 to 20 breaths per minute is considered normal for adults. Now, let's look at some common scenarios where you might need to take an apical pulse for a full minute. First, you might notice the patient is asleep, which can make it easier to get an accurate reading since there's less movement. Second, if the patient is anxious, it could affect their heart rate, so a longer measurement helps get a true picture. Third, in cases of arrhythmia, it's especially important to listen carefully for irregularities, and measuring for a full minute ensures you don't miss any abnormal beats. Lastly, with elderly patients, sometimes their heart rhythms are less predictable, so taking the full minute provides a more reliable assessment. Remember, the key point here is that you should perform an apical pulse for a full minute whenever there's suspicion of irregularity, or when precise measurement is necessary, to assess the heart's function accurately. All right, let's talk about the proper way to bend safely. First, always bend from your waist, but remember, keep your feet close together to maintain balance. The most important part is to keep your back straight. This helps protect your spine. Instead of just bending at the hips, bend your knees slightly to reduce strain. And finally, if you need to turn or twist your body, do so carefully. Twisting should come from your hips and shoulders, not just your back. The key takeaway here is that keeping a straight back and bending your knees is the safest way to lift or reach, helping you avoid injuries and stay comfortable. Let's take a closer look at the key principles here. The correct answer is B, autonomy. Explaining procedures is a way to respect and support a patient's autonomy. When we thoroughly explain what we're going to do, we help our patients make informed decisions about their care. This is fundamental to ethical practice. Now, the other options, justice, fidelity, and non-maleficence, are also important principles, but they serve different roles. Justice is about fairness, fidelity relates to trust and keeping promises, and non-maleficence means doing no harm. So, in the context of explaining procedures, autonomy is the principle that really highlights the importance of informed consent and empowering patients to participate actively in their healthcare choices. Remember, clear communication strengthens trust and ensures ethical standards are upheld. Now, when it comes to removing personal protective equipment, or PPE, it's important to do it in the correct order to prevent contamination. The first PPE item to remove is the gloves. This is because gloves are the most likely to have come into contact with infectious material. Removing them first helps minimize the risk of spreading germs to other parts of your body or your environment. Remember, always peel gloves away from your skin, turning them inside out as you go, and dispose of them safely. This step is crucial for maintaining safety and hygiene during the doffing process. Next, you'll move on to remove your gown, mask, and goggles, but getting those gloves off first is a key starting point. Let's talk about heat loss during sweating. When we sweat, our body is trying to cool down, and there are several ways this heat is lost. The options include radiation, convection, conduction, and evaporation. Now, among these, the most significant process during sweating is evaporation. Why is evaporation so important? Well, as sweat evaporates from the surface of our skin, it takes heat away with it, effectively cooling our body down. This process is especially critical in hot environments or during physical activity when our body generates more heat. The other methods, radiation, convection, and conduction, do play roles in heat transfer, but their impact during sweating is less dominant compared to evaporation. So, the key takeaway here is that evaporation is the primary mechanism for heat loss during sweating, helping us maintain our body temperature within a safe range. Now, let's look at the common sites used for intramuscular injections. We have 4 options here: the deltoid, ventrogluteal, dorsogluteal, and vastus lateralis. Out of these, the safest site for adult IM injections is actually the ventrogluteal. This site is preferred because it's away from major nerves and blood vessels, which reduces the risk of injury. It's also an area with a thick muscle layer, making it ideal for larger volumes of medication. When choosing an injection site, always consider safety first, and the ventrogluteal site tends to be the most reliable and safest option for adults. When it comes to routine urinalysis, there are several types of urine samples we might use. Today, I want to focus on understanding which sample is most appropriate for different situations. The options include a first morning urine, a 24-hour sample, a random urine, and a catheter sample. Now, among these, the most commonly used sample for routine urinalysis is the random urine. This is because it's quick, convenient, and generally provides sufficient information for initial screening. Unlike a first morning urine, which is more concentrated and better for specific tests, or a 24-hour sample that requires collecting all urine over a day, the random urine can be collected at any time without much preparation. A catheter sample, on the other hand, is more invasive and typically reserved for specific clinical situations, such as when a patient already has a catheter in place. So the key point here is that for routine urinalysis, the most practical and efficient choice is a random urine sample. It allows us to assess the urine's general appearance, concentration, and presence of abnormal substances quickly and effectively, fitting well into the overall theme of efficient diagnostic practices. Now let's look at the key steps involved in the nursing diagnosis process. On this slide, we see 4 options: A. Identify disease, B. Plan patient-centered care, C. Assist doctor, and D. Document meds. The correct answer here is B. To plan patient-centered care. Why is that so important? Well, nursing diagnosis is all about understanding the patient's unique needs and developing a care plan that centers around them. This step helps us prioritize interventions that truly make a difference in the patient's health and well-being. While identifying the disease, assisting the doctor, and documenting medications are all crucial tasks, they are part of the broader process. The core of nursing diagnosis is about creating a tailored, patient-focused approach. So, in essence, planning patient-centered care ensures that every action we take aligns with the patient's individual circumstances and goals. Now, before starting an NG feeding, it's crucial to perform a series of checks to ensure patient safety. First, giving the medications comes into play, but it's important to do this after confirming the tube's proper placement. Next, checking the stool can give us clues about the patient's gastrointestinal status. Flushing the tube is also necessary to keep it clear and prevent clogging. However, the most important step of all is to check the placement of the tube. Verifying that the tube is correctly positioned in the stomach or small intestine helps prevent serious complications like aspiration or feeding into the lungs. Remember, ensuring correct tube placement is a key safety step before beginning any feeding. Now, let's look at the best pressure ulcer prevention strategies. First, applying powder can help keep the skin dry and reduce friction. Using lotion is important too, as it maintains skin hydration and integrity. Repositioning the patient regularly, ideally every 2 hours, is crucial to relieve pressure and improve circulation. And finally, massaging redness can help stimulate blood flow and assess skin condition. Of these, the most effective method is to reposition the patient Q2H, or every 2 hours, to prevent pressure buildup. This simple yet vital step plays a key role in preventing pressure ulcers and promoting overall skin health. When we talk about touching a patient without their consent, we're really referring to a serious issue that falls under legal and ethical boundaries. The correct term here is battery, which means intentionally making physical contact with someone without their permission. It's important to understand that even if no harm is intended, doing something without consent can still be considered battery. Now, this concept is crucial in the context of patient care because respecting a patient's autonomy and their right to make decisions about their own body is foundational. If a healthcare provider touches a patient without asking or without their agreement, it can lead to legal consequences and damage the trust that's essential in healthcare relationships. So, to connect this to our overall theme, always remember that consent is key. Whether it's a simple touch or a more invasive procedure, always ensure you have the patient's informed agreement before proceeding. That respect and communication not only protect you legally, but also foster a safe and trusting environment for your patients. Now, let's look at some common scenarios where oral temperature measurement might not be appropriate. On this slide, we see several options: mild fever, anxiety, vomiting, and age 20. The key point here is understanding when oral temperature readings can be unreliable or contraindicated. For example, if a patient has vomiting, taking an oral temperature isn't recommended because the patient may have just vomited or be unable to keep the thermometer in their mouth properly. Similarly, in cases of severe anxiety, the patient might breathe rapidly or be uncooperative, affecting the accuracy. Age is another important factor. Very young children or infants are often better assessed with other methods like rectal or tympanic thermometers. So, the correct answer here is vomiting, as it directly contraindicates oral temperature measurement. Recognizing these contraindications helps us ensure accurate assessments and appropriate patient care. The correct answer here is B, which is 90 to 120 millimeters of mercury. When we talk about normal adult systolic blood pressure, we're referring to that top number, the pressure in your arteries when your heart beats. Maintaining this within the range of 90 to 120 is crucial for good cardiovascular health. If it's consistently above this range, it could indicate hypertension, which increases the risk for heart disease and stroke. On the other hand, if it's too low, it might suggest other health issues that need attention. So, understanding and monitoring this range helps us keep our hearts and blood vessels healthy over the long term. When it comes to side rails for confused patients, it's important to understand the different options and their implications. The choices include restraint, fall prevention, abuse, and violation. Among these, the correct approach is fall prevention. Using side rails as a fall prevention measure can be effective, but only if it's done appropriately. The goal is to protect the patient from falling out of bed, which can cause serious injuries. However, it's crucial to consider the patient's level of confusion and overall safety. In some cases, side rails might be misused as restraints, which can lead to abuse or violations of patient rights. Therefore, we need to evaluate each situation carefully. Proper assessment ensures that we utilize side rails in a way that enhances safety without infringing on patient dignity. So remember, the key is to use side rails thoughtfully, primarily as a fall prevention tool, and always prioritize the patient's safety and rights. When it comes to primary sources of patient data, the most important one is, without a doubt, the patient themselves. They are the main source because they directly provide the information about their symptoms, history, and experiences. While family members, nurses, and records are also valuable, the patient's own account is crucial because it offers the first-hand perspective. This helps us understand their condition from their point of view, which is essential for accurate diagnosis and effective care. Remember, the patient's information forms the foundation for all subsequent assessments and decisions, making them the primary source in this context. When it comes to measuring temperature in adults, there are several sites we can choose from. The oral method, which is quite common, involves placing the thermometer under the tongue. Then there's the tympanic or ear method, which uses an ear thermometer to get a quick reading. Axillary or underarm is another option, often used for its simplicity, but it can be less accurate. And finally, we have the rectal site, which involves inserting the thermometer into the rectum. Now, the key point here is that among all these sites, the most accurate temperature measurement for adults is actually the rectal route. This is because it provides the closest reflection of the core body temperature, which is essential for accurate assessment. While other methods are convenient and useful in different situations, the rectal temperature tends to be the most reliable, especially when precise readings are needed. So, in summary, although you might see various methods used in practice, remember that the rectal site offers the most accurate temperature measurement in adults, and that's why it's often considered the gold standard in clinical settings. Now, let's take a closer look at the key methods for breaking the chain of infection. On this slide, we have 4 options: wearing mask, hand hygiene, gloves, and isolation. While each of these plays an important role in infection control, the most effective method in stopping the spread of infections is actually hand hygiene. Practicing proper hand hygiene, whether it's hand washing with soap and water or using an alcohol-based hand sanitizer, removes germs from our hands and prevents them from transferring to patients, surfaces, or ourselves. It's simple, cost-effective, and one of the most impactful actions we can take. While wearing masks, gloves, and isolating infected individuals are also crucial, they are often supplementary to the core practice of hand hygiene. Maintaining good hand hygiene consistently, really, is the cornerstone of preventing infection transmission in healthcare settings. So remember, the best method to break the infection chain is, without a doubt, hand hygiene. Now, let's clarify what a clean technique really means. When we talk about a clean technique, we're focusing on practices that reduce the risk of infection by controlling the spread of microorganisms. The correct answer here is B, medical asepsis. This involves practices like hand hygiene, proper handling of equipment, and maintaining a clean environment to prevent the transmission of pathogens. It's different from surgical asepsis, which aims to eliminate all microorganisms, including spores, and is used in sterile procedures. Sterilization is an even higher level of asepsis, involving the complete destruction of all forms of microbial life. And high-level disinfection is used for items that contact mucous membranes but are not sterile. So, in essence, medical asepsis is about creating a clean environment that helps keep both patients and healthcare workers safe by reducing the chance of infection. And now, as we come to the end of our presentation, let's consider the importance of maintaining professionalism and respect in every interaction. The correct answer here is a closing curtain. This means respecting patient privacy and dignity by ensuring the environment remains private and secure. It's about knowing when to step back and give the patient space, especially during sensitive moments. Speaking loudly, sharing info without consent, or ignoring the patient are all behaviors that can breach trust and compromise care. So, closing the curtain symbolizes creating a safe, respectful space, an essential part of maintaining confidentiality and professionalism throughout our practice. Remember, respecting boundaries is key to building trust and delivering excellent care.